afternoon, and welcome to ChangeLab Solutions webinar on policymaking to advance health and racial equity. I'm Sabrina Adler, and I am going to be moderating today's webinar, so thank you for joining us. For those who are new to ChangeLab Solutions, we are a nonpartisan nonprofit organization that uses the tools of law and policy to advance health equity. And we have an interdisciplinary team. We partner with communities across the nation to improve health and opportunity through policy change. So we encourage you to check out our website to find out more information. We have many free resources on a wide variety of topics related to health equity policy and the law. And you can Google us to find us or use the QR code on this slide. So now on to today's topic. As I mentioned, my name is Sabrina Adler. I am the Vice President of Law at ChangeLab Solutions. And today I'm really thrilled to be joined by my colleague, Katie Michael, who's a senior attorney, as well as by two external partners with whom we work closely. So Girdhar Malia, who's a senior policy officer at the Robert Wood Johnson Foundation, and Amalia Smirniotopoulos, who's a senior policy counsel and co-manager at the NAACP Legal Defense Fund's Equal Protection Initiative. We are going to cover a lot of ground over the next 40 or 55 minutes or so. So after I finish kicking us off here, we are going to move into a panel discussion with Girdhar and Amalia about why this work is important and what is happening right now in the courts and in other parts of government. Then Katie is going to provide an overview of some of the key concepts in a new resource that ChangeLab Solutions just released, which is a legal primer for policymaking to advance health and racial equity. And then we will leave some time for questions and answer as many of them as we can get to before we wrap up. Before we dive in, just two quick reminders. Everyone that registered signed or agreed to ChangeLab's conduct policy, and you can see it here on this slide. I'm not going to read it, but what I am going to emphasize too is that although many of us speaking today are lawyers, we are not your lawyers, and therefore we are not providing legal advice and cannot provide legal advice. So if you have specific legal questions, you should always consult with an attorney licensed to practice in your jurisdiction, and I will remind folks of that again when we get to the questions. And with that, we can dive into the panel discussion. So I will welcome Girdhar and Amalia to join me. Hello. So I am going to kick us off with just some grounding on what we're talking about here today. And I'll point this first question to you, Girdhar, though for all these questions, both of you should feel free to weigh in if you have thoughts. But can you just do some level setting here for us about what we mean by policymaking to advance racial equity, why it's important, particularly for public health and healthcare?
Sure thing. And thank you, Sabrina, for hosting us today and just for the amazing work that ChangeLab does every day across the country to, as you said, make communities healthier. I'm so glad to be talking about this. It's just, I think, really important for people with shared values and a commitment to equity to be in conversation with each other about what we're facing right now and how to keep moving forward. Because I think that's what our mission calls us to do. And that's what our partners in communities are really relying on us to continue. So with that, you asked, what does work to advance racial equity mean to me? So three things come to mind. The first is that this is work that is about redressing the harms of discrimination, both past and ongoing. Second, that this is work to close racial health gaps. And I think that's a key feature. And then finally, I think an important thing that often doesn't get mentioned is that racial equity work, when done well, is also about changing systems so that they serve everyone better. It is not a zero-sum enterprise, and I think that is something that people opposed to this work are really trying to promote. But I think all of us know that that is not the case, that this is ultimately about work that everybody can benefit from.
Yeah, thank you for lifting up, especially that third point. And Amelie, anything you want to add to that sort of level set?
No, I think that was a great
Okay.
encapsulation.
Great. So then maybe related and building on that, back to you, Girdhar, and then Amelie, I'll turn to you for this one too. But can you give some examples of policymaking to advance racial equity? Maybe ground us just in some concreteness here.
Sure thing. I think what we're going to realize over the course of the conversation, something that people already know, is that racial equity work is really broad and diverse, and it can look different in terms of policy design and implementation and enforcement, and also what it means in terms of how we need to think about legal rules and risks. So we'll get into that. But I'll give three quick examples that I think are kind of across the spectrum of what racial equity work can look like. So the first, I'll start with an example outside of health. I'm thinking about the reparations program in Evanston, Illinois. And that is specifically for descendants of Black residents from the early 20th century in Evanston who were denied homeownership opportunities. And this program is available to descendants of those people. And it is basically a grant program to help with homeownership or home repairs. And I think core to this program is that it's targeted to a particular racial group. And it truly is about repairing past harms. So that's one example. A second, I think of some work that I did in Philadelphia with colleagues that was more focused on a community, and that was people who live in public housing. We know that Black and Latino families were overrepresented and are overrepresented in public housing in Philly. And we specifically wanted to focus on reducing secondhand smoke exposure in public housing. And a goal for us was to reduce exposure for everyone, but to see particular benefits for Black and Latino families where there were also higher rates of asthma and other respiratory illnesses that were sensitive to secondhand smoke exposure. And then a third, really highlighting that last point I made about universal benefits, is an initiative around cancer care that was developed by the Greensboro Health Disparities Collaborative. Some of you might know about it. And it looked at this idea that everyone kind of struggles getting cancer care in ways that meet their needs. You're sick. It's a hard thing to navigate, especially when you're sick. Lots of appointments, lots of different doctors. And they said, we see particular problems for Black patients in our system in getting high quality cancer care. So they looked at the experiences of those patients and then redesigned their systems and made them available to every person who had cancer in the system. It included cancer care navigators that were culturally competent. It included racial equity training for all their providers. And finally, it looked at data by race to see whether and how this intervention was actually making a difference. And it did make a difference. It reduced racial gaps in timely cancer care, and it also improved those outcomes for patients of all races. So those are a couple quick examples that come to mind.
Thank you. Yeah. And I think we'll see as we go on that those examples also really tie to what's happening and how the legal doctrine in this space applies. So with that, I think maybe, Amalia, I'll move to you and just say, I think it goes without saying that there's been a lot happening when it comes to quote unquote DEI. And I put that in quotation marks because I think that means different things to different people, and just policy making to advance racial equity generally, both in the federal presidential administration, which has taken many actions, but also in the courts and at the state level as well. And so I would love to hear from you more about what trends you're seeing, what should folks be aware of, and sort of what's happening in this space right now and for the, in the last months and years.
Yeah. Thank you, Sabrina, and thank you for having me here today as well. So first I want to zoom out a little bit just to put what we're seeing in context. So just as you were saying, we've seen over the past 15 months or so, the Trump administration dismantle programs designed to ensure equal opportunity within federal government, to terminate or threaten to terminate grants to organizations that advance diversity, equity, inclusion, and accessibility as fundamental values, and to target organizations and individuals that not only do those activities, but also support immigrants, engage in First Amendment protected activity, and other subjects. I think it's really important as we are looking at this landscape to understand that these attacks are not new. They're part of a long-term strategy that is designed to change how courts interpret existing laws in order to dismantle tools we've relied on for decades to ensure that Black people and other people of color, women, and other protected groups can access healthcare, educational, and other economic opportunities. These attacks began shortly after the passage of some of our core civil rights laws, like the Civil Rights Act of 1964, and have included, longstanding efforts to limit the interpretation of those laws, restrict our ability to address discrimination, attempts to end affirmative action and other active steps to remediate discrimination, and to ban equal opportunity programs at the state level. And obviously, these attacks have accelerated since President Trump took office. I talked about some of the key actions that we've seen. Fundamentally, the goal behind all of those actions is the same. It's to weaponize federal agencies and go around the democratic process in order to get compliance with an agenda designed to limit our ability to actually ensure equal opportunity in this country across both the public and private sectors. These actions have been challenged by multiple lawsuits, including by my organization, LDF, and many of these actions have been blocked in courts. I think there are a couple of key takeaways to have in mind. First, while we've seen the administration use a number of different tactics, from executive orders to guidance documents, dear colleague letters, and others, those actions in and of themselves cannot change federal statutes. That power is reserved for Congress. While they can direct federal agencies to take specific actions, and agencies can draft memos and guidance documents explaining how agencies might interpret laws, neither federal agencies nor the president himself can actually change what the laws say and what they mean, because that power is only within the courts and with Congress. And so bottom line is, if your programs were lawful before January 20th, 2025, they are still legal now. Second is that when the administration has been pressed about what it is trying to do through these actions, they have represented to the court repeatedly that they are only trying to apply the law as it exists right now, not impose new legal requirements. And when the Trump administration has strayed beyond what the courts currently define as within the bounds of federal anti-discrimination law, they have been blocked by courts. So, for example, when they tried to force pre-K through 12 schools and higher education institutions to comply with a broad and radical interpretation of what is prohibited under federal civil rights law, they were blocked by 3 different federal courts and eventually had to abandon their attempt to impose those restrictions. Finally, I'll just say that the Trump administration, has been trying to use very vague and confusing language to make it hard for people to understand what they can do under these new restrictions. But when these kinds of vague language touches on, protected expression, or is so vague that people are not sure how to comply with the law, that raises constitutional concerns that also has led to successful legal challenges in court. So given all of these different factors, what we are encouraging organizations to do is to be guided by what the law actually is and take a step back and not be overly chilled by inaccurate statements by the Trump administration.
Yeah, thank you. I really want to underscore the point that you made about if what you were doing was legal before the Trump administration came into office, then it is still legal now. And likewise, the reverse is also true, that unilaterally the administration cannot just change sort of the underlying civil rights laws that we are operating, that framework that we're operating in. So thank you for that. I just want to focus on one thing that I think is going to come up a lot through the rest of this conversation, which is folks have probably heard the terms race-based and race-neutral. They have both legal and non-legal meanings. I think today we're probably more focused on the legal meaning, and I think they're important terms to understand when we're talking about this kind of policymaking. So I'm hoping, Amelia, can you just explain to everyone what they mean?
Yes. So at the most basic level, an action is race-based when race is an explicit factor in the decision, showing that there's an intent to discriminate. So to take Giridar's prior examples, the example of the reparations program in Evanston was an explicitly race-based program. By contrast, an action is race neutral when race is not a factor in the decision. And so there's no explicit intent to discriminate based on race. And so the two programs about, focusing on people in public housing, or even the program in Greensboro, which was designed to remedy disparities for Black cancer patients, but ultimately offered services to everyone equally, would both be considered race-neutral programs.
Yeah, thank you. And that this is going to be a theme that recurs, but I think the important piece here is that even though something can be race neutral from a legal perspective, that doesn't mean that it is not a policy that can address racism and racial disparities. Sometimes in certain contexts, and this is, there are different uses for these terms, but some folks use that term to mean just ignoring colorblind, which I think is not what we're talking about here today. We're talking about a legal distinction. Great. Okay, I have one more question for you, and hoping both of you can touch on this briefly, at least if you have thoughts, but maybe I'll start with you, Amelia, and then go to you, Girdhar. But and you touched on this a little bit already, but we're seeing and hearing a lot about risk in our work. It feels like every conversation that we have, for really good reason, how to navigate risk right now is coming up. The risk of litigation, as you pointed out, the risk of losing funding, even if that funding rescission or withdrawal is not legal. There's still that risk there and more. And so I'm hoping that you can talk just a little bit more about risk. I know we get this question a lot, like, is now the time to be doing this work? What are the risks of moving forward, and what are the risks of retreating? And I know, again, there's legal risks, but there are also many other types of very real and important risks to consider. So
I'll focus first on the legal risks. And I think it's important to acknowledge that in every decision that we make, there are going to be risks. And it's a question of balancing your risks, understanding what risks are worth taking based on your values. And that's a very individualized conversation for each organization to undertake. I also think about risk as a spectrum, because there is different steps in the process that we should be thinking about. There's a risk that a program might come under scrutiny, which is different than the risk that you might actually be able to defend that program in court because you have a strong legal basis for pursuing the tactics and good reasons for doing so. And so I think distinguishing between those two different things is important in this moment. And I'll also say there are risks to not actually undertaking these kinds of racially equitable programming. There are, beyond what the Trump administration is saying, there are longstanding obligations that healthcare providers have because they receive federal funds, because they employ, large numbers of people that are already in place and require them to ensure equal opportunity in terms of who gets access to their programs, who they hire, and how those people experience the workplace. And a lot of the programs that we're talking about are programs that are designed to advance those civil rights goals. And so if you do not take steps to ensure equal opportunity or roll back existing programs, that itself can create a risk that you might be out of compliance with those core civil rights principles.
Yeah, thank you. Those are all really important points. Girdhar, do you want to add to that?
Yeah, I love all of those, and I'm really glad Amalia mentioned the civil rights obligations as well. Maybe just to pick up on that, I think for many in the health and public health space, a core part of our mission is ensuring equal opportunities to health. So if we are pulling back from programs that advance racial equity, we run the risk of worsening disparities. Just bottom line. And that should really be at the forefront of our considerations of risk. It's not just risks to us, but it's risks to the communities that we are a part of and that we are serving. That's one. Two, and relatedly, is that public health is in a period, and health generally is in a period where it is trying to reestablish trust with many, many different types of communities, particularly historically marginalized ones. If we start pulling back, especially when we don't need to, a very natural and defensible reaction from people in communities is to not trust us anymore, especially if we said, we care about racial equity and we are willing to take on the risks. But then when we actually face them, we say something different. So I think maintaining relationships and maintaining trust is a really important part of the risk calculation. And the last one I'll mention is maybe I'll describe it as a narrative risk. But part of what we're seeing with attacks on racial equity is that, yes, it's to dismantle programs related to racial equity and civil rights, and it's often used as a rationale to do other harmful things. So in the policy dialogue around cuts to Medicaid or to SNAP or to other public programs, illegal DEI along with waste, fraud, and abuse were part of this larger narrative. And I think if we don't stand up for and continue work to defend racial equity, then it feeds into this narrative that, yeah, maybe this work is illegal. Maybe it's not effective. Maybe it is un-American. So that is another important part of considerations of risk as entities think about either stepping back or leaning in.
Yeah, thank you. So many things to consider. And I think a really great way to tee up passing things off to Katie, who's going to dive into some of the legal issues here and walk us through some of the key points from the legal primer. So we will see everyone back for the Q&A, but I'm going to hand it to Katie.
Thanks, Sabrina. We know that many of you have questions about how to navigate some of the challenges that Amalia and Giridhar were just describing, and really what you can do to protect or continue policies and programs that advance health and racial equity in the evolving political and legal climate. With support from the Robert Wood Johnson Foundation, ChangeLab Solutions recently published a legal primer that addresses these considerations and more. And it's intended to support policymakers, government practitioners, and community partners really in thinking strategically about how to adhere to their values while accounting for their local context as well as their tolerance for legal risk. The primer itself comprises a set of questions from why this work is important to what legal standards govern equitable policymaking and how you can apply legal concepts in practice. While you can read the primer from beginning to end, each section can also stand on its own. So you can always just start with the question that's most relevant to you right now. And you can also just read our executive summary if you want a quick take. Since Amalia and Giridhar have already touched on the why and described the legal landscape at a high level, we wanted to preview some content in subsequent sections focusing on the what and the how. And I'm going to run through this pretty quickly so that we have enough time for Q&A, but everything that I'm covering is in the primer itself if you want more detail. So to start out, what legal concepts should changemakers be aware of when using policy to advance racial equity? Civil rights law is the body of law most directly implicated by policymaking to advance racial equity, and it includes the legally enforceable right to be free from discrimination. This right is enshrined in federal and state constitutions, as well as in federal, state, and local anti-discrimination laws. These laws were originally intended to protect people who are devalued and disempowered in society because of their race, ethnicity, or other dimensions of identity like gender and physical ability. But opponents are attempting to leverage these same laws to argue that governments and institutions should never take race-related concerns into account, even as a broad policy goal to benefit the very groups that the laws were intended to protect. It's important to remember, however, and this relates to some points that Amalia was making, that only courts can decide whether specific policies and practices constitute unlawful discrimination. So let's take a closer look at what courts have said to shed light on where there might be opportunities for policymaking to advance racial equity. As many of you likely know, a cornerstone of civil rights law is the Equal Protection Clause, which is in the 14th Amendment to the U.S. Constitution, and it establishes that a government body may not deny people equal protection under the law. Put another way, governments can't distribute different benefits and burdens to individuals who are similarly situated without a valid reason. It's important to note that the 14th Amendment only restricts government action. However, other federal and state laws extend to private sector actors as well. So when a government action is legally challenged based on a claim that it violates equal protection, courts will apply a certain standard, and each of these standards entails different requirements that courts will consider. This can quickly get complicated, but for today's purposes, the key is that strict scrutiny generally applies to race-based policies and is a very demanding standard. And rational basis review generally applies to race-neutral policies, and it's a lenient standard, though there are some exceptions that I'll cover. So for example, consider a public health policy prioritizing vaccine distribution explicitly based on race. This type of policy is likely to be legally challenged, and because it would be subjected to a demanding standard, strict scrutiny, there's a strong likelihood that it would be struck down in court. By comparison, consider a policy that prioritizes vaccine distribution to neighborhoods based on residents' median household income. In practice, that policy has potential to reduce health disparities, including health disparities based on race. But unlike the explicitly race-based policy, it is less likely to face a lawsuit. And even if it did, there's a strong likelihood that a court would uphold it. That said, race-based policies are not inherently unlawful. Even race-based policies can sometimes be upheld by courts so long as they survive strict scrutiny, meaning the policy promotes a compelling government interest and is narrowly tailored to achieve that interest. I know that probably sounds like a lot of legalese, but another key takeaway here is that courts have explained that remediating specific identified instances of past discrimination can be sufficiently compelling to justify the use of race-based classifications in some circumstances. There's a significant opportunity for public health researchers to play a role here in building an evidence base to better understand the health effects of discrimination that can then support remedial or reparative policies that explicitly take race into account. Next, let's unpack rational basis review. And again, this applies to race-neutral policies. To survive rational basis review, the government must merely show that the policy promotes some legitimate government interest and that the policy is rationally related to achieving that interest. This is a relatively easy standard to meet. For example, a conceivable legitimate rationale for a vaccine distribution policy prioritizing populations based on race-neutral factors like income might be that it reaches people experiencing a higher disease burden. While in the context of equal protection, race-neutral policies are typically subject to rational basis review, there are certain circumstances when they might be more closely scrutinized by courts. specifically when there's evidence that a policy is motivated by what courts call a discriminatory intent or purpose. And this is an area where courts are active right now as opponents are increasingly challenging race-neutral approaches to advancing racial equity. Importantly, courts have explained that mere awareness of a policy's racial effects is not enough to prove discriminatory intent and subject it to strict scrutiny. Rather, challengers must show that a policy was selected specifically because of its effects on certain racial groups. And to find discriminatory intent, courts are going to look really closely at the policymaking record, and they might also look at studies showing that a policy or government action adversely affects one racial group more than another after it was implemented. So continuing the earlier example, a government policy that prioritizes vaccine distribution to neighborhoods based on residents' income levels would likely be subject to rational basis review. But if government officials make statements, especially during the formal policy adoption process, indicating that they intend for the policy to have certain effects on vaccine access based on race, a court may be more likely to apply strict scrutiny and to declare the policy unlawful. Before moving on, I want to quickly flag that there are a number of federal statutes that may inform policymaking to advance racial equity, as well as state and local laws. And we don't have time to get into the details, but I just want to emphasize again that these often expand on equal protection by extending to private sector actors. So like discrimination by housing providers, private employers, or hospitals and clinics that receive federal funds. And to learn more, you can check out the primer. So this was already a lot of information, and some of you might still be wondering, how do all of these concepts apply in practice? What does this mean for me, my work, and my community? First, I want to emphasize that no court has held that policymaking to advance racial equity is in and of itself impermissible. Within this legal landscape, there are many strategic opportunities to pursue equitable policymaking. I also want to emphasize that when weighing different policy options, there are different types of legal risks to consider. First, there's the risk of facing a court challenge or of being threatened with a loss of funding or other out-of-court enforcement action. And then second, there's the risk of the policy actually being invalidated by a court, or funding being withdrawn, or some other enforcement action resulting in a negative determination. And importantly, the risk of drawing a legal challenge or other threatened adverse action is not the same as the risk that the policy will actually be deemed illegal. That risk depends on settled law, and as I just described, is highest when the standard of review is strict scrutiny and less when the standard of review is rational basis review. And this relates back again to what Amalia was describing, that the power to say what the law means rests with the courts and not with federal executive agencies. And so it's important not to be overly chilled by statements by federal agencies or misstatements about the law. With that in mind, when selecting an approach, the following key points and examples may be helpful. And most of these examples pertain to educational access, since that's one area that has been frequently litigated, but the examples could be analogized to healthcare or public health issues. I'm also going to use the phrases likely permissible and likely impermissible when describing examples. And I say likely only because it's impossible to predict how a court would rule on any policy in the abstract without knowing the full details. And it's really important for changemakers to consult with an attorney licensed in their jurisdiction to get tailored advice before pursuing any particular policy approach. So first key point, policies that use explicit racial classifications to distribute benefits or burdens to individuals face the highest legal risk, but may nevertheless be permissible if they remediate specific instances of past government discrimination. An example of a policy like this is the explicit consideration of race in assigning students to public schools when that's in furtherance of mandatory school desegregation decrees. Desegregation decrees are binding agreements forcing school districts to eliminate racial discrimination. In other words, they're specifically designed to remediate discrimination that has been perpetuated by the school district and has often been proven previously in court. By contrast, an example of a race-based policy that is likely impermissible is one that explicitly considers race in assigning students to public schools, where the record only includes general evidence of societal discrimination in the school district or the region. So, in other words, without tailored evidence showing specific instances of discrimination perpetuated by the local schools, a race-based policy like this is unlikely to pass constitutional muster. So, second key point, race-neutral policies adopted with awareness of their potential positive impact on different racial groups, especially policies that allocate benefits based on a broad category such as income, are generally permissible. However, the legal risk may increase if there is evidence of what courts call an impermissible racial purpose. Again, this is an area where there's active litigation and judges have gone different directions in different cases. Based on current case law, a policy or plan that assigns students to selective public schools based in part on family income would likely be permissible, even if school administrators adopt the plan with an awareness of its potential to equalize opportunities based on race. However, the risk may increase if school administrators have stated in public meetings that the purpose of the plan is to increase racial diversity, and studies show changes in admissions rates by race after the plan is implemented. Again, this is an area of the law that's currently in flux, and the line between awareness and intent can be fuzzy. So the policymaking record really matters here to avoid the application of strict scrutiny. Third, and very importantly, the Equal Protection Clause is implicated only when a government treats groups differently when allocating benefits or imposing burdens. And this leaves open categories of policies that fall outside of the equal protection framework and that are generally less legally risky. So, for example, aspirational goals to address racial equity, such as those embodied in declarations of racism as a public health crisis, or the collection of race and ethnicity data to identify disparities in healthcare and other contexts, are both generally permissible practices. Again, I'm using the words likely and generally only because it's impossible to say how a court would rule on any policy in the abstract. Finally, there are many race-neutral policies that would fall outside of equal protection framework because they establish universal protections that are available to anyone across an entire industry or all people with a particular health condition. For example, heat protections for agricultural workers can reduce health disparities across racial groups and generally carry low legal risk. Similarly, evidence shows that Medicaid reimbursement of doula care can improve maternal outcomes for all birthing people and reduce maternal health disparities based on race. This is really a huge category to explore, and it is where so much public health policy work lives, so there's a lot of promise to advance health and racial equity here. And public health research can help to illuminate these policy opportunities. Finally, I want to quickly share some strategic considerations and practice tips before we move into Q&A. So first, establish an evidence base. I know I've mentioned opportunities for public health researchers several times, but I want to hammer it home again. There is a real opportunity for public health research to build an evidence base that helps to illuminate policy opportunities or evaluate policies after they're adopted to assess their racial equity impacts, and to proactively build an evidence base that can help to defend policies in litigation. Second, efforts to advance racial equity should include a range of partners. Working in multi-sector coalitions can ensure that there are feedback loops and ongoing communication between researchers, policymakers, and attorneys, which can help to, again, build the evidence base. And engaging communities that are experiencing inequities increases the likelihood that policies will actually be effective, and it can increase government accountability and support buy-in and support for policy change. Next, select and design a policy. At this step of the policy process, it's really important to consult attorneys early and often. They can help determine whether a policy is legally feasible in your jurisdiction or help to identify less legally risky alternatives that can advance community goals. So attorneys are really your partners here. They can also help changemakers consider their available resources to defend policies in litigation, and also whether litigation could result in legal precedent that could limit or undermine future policymaking to advance racial equity, and when pursuing different approaches or not defending a policy that has been challenged might be a strategic decision. As Amalia described, legal risk calculations are going to be really different in every community, and it is really important to weigh these legal risks against the real risks to communities of not acting. Next, develop the policymaking record. To emphasize this point again, the policymaking record is going to be closely scrutinized by courts if a policy is legally challenged. Especially for race-neutral policies, it's generally not the text of the law that's legally problematic, it's the record. And that's what the court is going to look to determine if a policy is motivated by what opponents are arguing is discriminatory intent. So again, it's important to include attorneys early in the process and have a plan and ensure that everyone is on board about what the legal risks are and why the record matters. Finally, policy implementation, enforcement, and evaluation are key parts of the process to ensure that policies are actually working as intended. And I don't mean this to seem like an afterthought because it's at the end, because it isn't an afterthought. Even a policy that is designed to advance racial equity can fall short in reaching its goals if it isn't implemented effectively, or the processes used to implement the policy are themselves inequitable. I've been talking a lot. I'm going to stop talking now. And Dan, you can take the slides down and move into Q&A.
Thank you, Katie. That is an incredible amount of information. I thank you for distilling it so clearly. And I know folks may need time to process and to access other resources to process. So please, everything that Katie has said comes from the legal primer that we have developed. So you can refer back to that resource. And I know folks are also asking about the recording and slides. You will get those and you can listen to it again and refer to the slides as well. So with that, we can move into the Q&A, and I see there's some active questioning and answering happening in the question box. We also asked folks ahead of time if they had questions that they would like us to address. So there were some questions that came up many times in those pre-webinar list of questions. So I'm going to start with a few of those. Some of them overlap with some of the stuff in the question box, and then we will move to questions that we're also getting in real time. But let me start maybe Gear with you, though of course others can weigh in too. I think this is related to the communications question a little bit that we already got in the chat, but we have a lot of questions, and we touched on this a little bit at the beginning, but how can you do this work in environments that are just not supportive of advancing racial equity? I think is a question that we get all the time. And I think we've touched on some ways, but maybe we can just tie some threads together here.
Yeah. Well, I think you have to do it very thoughtfully and courageously and persistently. The reason I chose those words is because we all have to be aware of the context that we work in, and what is possible in one community may not be possible in another. And that is just the reality that people face, especially in certain states and in certain communities. So be very clear-eyed about what your context, what your political and social environment do and don't allow, or at least what the parameters and guardrails are. I think the second, and this is relevant to any kind of social change work we do, understand who your allies and opponents are. I think what we find is that the folks who are able to keep this work going in one way or another, despite the conditions that they find themselves in, have built up a set of relationships and allies that they can go to when things get tough. When they're told that this particular approach that they were told was allowable last year is now no longer allowable. Having another set of people that you can go to check yourself, to maybe advocate for you with that decision maker, that is so important. So all the work that you've already done, it can feel like it's a total loss when somebody cuts a program that you devoted so much time and energy to. But think about all the other things that you built, the relationships, the research base, the community partnerships. I think that is really key. And the third is, in an environment like this, you may not be able to do everything that you were doing 18 months ago. But I think what we've seen from some folks is it has forced them to say, which of our racial equity efforts do we think is so effective and so closely tied to our mission that we're willing to go to bat for it. And that kind of concentrates people's energy and focus and allows them to kind of push that forward. So I think it sometimes does also require some prioritization.
Thank you. Does anyone else want to weigh in on that question? Or I have maybe like a related question that I'll pose to you, Amalia, and then we can branch from there. But I know we've also gotten questions about how to empower community members to advocate for themselves and their communities when it comes to policymaking to advance racial equity. And I'm wondering if you have thoughts on that, which I think related to what Girdhar has been talking about.
Yeah. I mean, I think we need to remember that, the people that are closest to decision makers are often the most powerful. And that means that that's not necessarily me sitting at a national civil rights organization. That is people in communities who are working in institutions, who are receiving care from institutions, who are the constituents that legislators are ultimately responsible to. I think there are a couple of different ways that those kinds of stakeholders can exercise their power. First is coming to the polls and voting, making sure that you're participating in elections at every single level, from the local level through state and federal. It's often the state and local decision makers that are making some of these key policy decisions about how things are playing out in practice. Two, I think that there's a lot of opportunity for storytelling from community members to talk about their experiences receiving care, trying to access services, both the negative stories about the barriers that they've experienced to help us identify what needs to be overcome, but also the positive stories of programs that have been working. And both of those stories are necessary to build the record that we might need, but also to build public support for efforts to try to address, the disparities we know exist.
Yeah, I just want to heartily +1 that storytelling piece and sort of the information that we can be providing to folks that are really advocating in this space. I think sometimes, particularly in public health, we can be a little bit disconnected from the folks that are directly working on civil rights litigation, and having that connection is, I think, really critical on both sides. So, Katie touched on this a little bit. And so, Katie, maybe I'll start with you. Just remind us why this is important. But then I want to talk about the research needs in this space, because I do think we have some researchers that are in the mix with us today. And so there are legal reasons why research is important. If you can just briefly remind us how that comes into play. And then Girdhar, maybe talk a little bit more about what you're seeing about when it comes to research needs.
Yeah, I mean, again, there is race-based policies can sometimes be permissible when they remediate specific instances of past discrimination. And so one of the research needs there is just really building that evidence base to connect discrimination to health harms and other harms that can help defend the policy if it is legally challenged. And then there are also just general research needs that can help to illuminate opportunities when race-neutral policies can address health disparities based on race. And I think that's another place where research can really be helpful. And then many more, but I'll stop there.
Yeah, I'll just jump in here on the point of specific instances of discrimination. I think people who are doing the work of racial equity advancement in health are going to need to get much more fluent and able in documenting specific instances of discrimination in your community or in your institution or in your context, and then linking that to specific health harms. That then opens up the possibility for these race-based reparative strategies that I think so many of us want to see move forward, because we know that they are essential to making truly equal opportunities for health possible. And I saw a question about that as well. A model that I like to point to from another field, and Sabrina's heard me talk about this, is special purpose credit programs, which are authorized by law and which enable communities and lending institutions to make certain types of loans, for example, home loans, available to specific communities, including communities defined by race, all in the context of trying to redress the harms of housing policy and social policy from years past that really kept people of color outside of home ownership. And one of the steps in the process of actually establishing a special purpose credit program is specifically documenting in your community what was the discrimination in the housing market and how did it lead to disparities in home ownership. And I think for health, we need similar frameworks and tools so that it becomes a little easier for health leaders to actually document these specific instances of discrimination that then can allow for specific reparative policies for specific communities.
Yeah. I'll just add very quickly two additional areas. One, really getting granular about who is suffering these different health disparities. So one of the things that courts look at is like who is included and who is excluded in particular kinds of programs. So documenting, how health disparities play out across different populations, and thinking about the ways in which things like socioeconomic status and race might interact, or different subpopulations within larger racial categories, I think could also be really valuable. And then more on the public messaging side, we've talked about, how race neutral programs often benefit everyone in a community. And so we might have a goal of addressing disparities for a particular population, but I think being able to really document the ways in which these changes can improve health outcomes across the board can help build the public case for why we need to be leaning more into these kinds of policies.
I just want to pick up that thread because I mentioned this earlier, and Girdar, I know you answered a question about this in the chat, but this communications question comes up all the time. And I think you had pointed to some resources that folks might find helpful in terms of how to talk about this work across different contexts. And so just wondering if you can lift that up verbally, and then if other folks also have other thoughts about resources. I will say this is something that comes up for us very frequently at ChangeLab too.
Yeah. I assume this was part of the question, but it's often an unstated part. And that is that it can't just be about the words that we use or how we communicate. That needs to be closely tied to what our underlying strategy actually is. And one without the other is kind of incomplete, and it's probably doomed to fail. That's the first point. The second is that we do have another partner called Throughline for Health Equity. I encourage folks to sign up and become part of the network. And it's specifically around communication strategies and tools as it relates to racial health equity. They did some really fascinating research with people that are somewhere in the middle. So open to conversations on race and health, but not strident advocates. And two things came up in their research. And it was about two core needs that people have when they're talking about or thinking about race and health. The first is security, and the second is belonging. So security, am I going to be harmed by this thing, whatever it is we're talking about, this policy, for example? And then the second is belonging. How can I be a part of this? Especially if you say this is a good thing for my community, even if it may not be directly relevant to me. And being able to speak to those two needs up front is really, really important, because the opposition is speaking to those needs of security and belonging all the time. And to the extent that we don't do that, then that just creates a vacuum that the opposition can fill. So there's a lot of other good advice, but that felt new to me. And I have started to incorporate that into how I have conversations about this type of work with diverse audiences.
Thank you. I'm going to close this out with a question that hopefully everyone can answer briefly and then move us just to some final logistics. But before I do that, two things. One, there's a lot of questions still that we just haven't had a chance to get to. And so to the extent that is affiliated with a name, we can try to follow up with you offline. And also all of these questions that you were asking, both now before the webinar, and we will have a survey after, are informing the work that we will be doing in this space to try and really address what folks' needs are. So please stay tuned. I do want to just quickly lift up that there's like a thread of conversation about this issue of documenting harms and understanding the history, and ChangeLab does have a body of work on that specifically. And so if that's something that you're interested in, please reach out. We're happy to connect with you more about that, or just stay tuned on our website and our mailing list, because we do have more work to come on that specific issue. And with that, I'm just going to do a one sentence because somebody asked it, and I think it's nice to end on an uplifting note. What is giving you hope right now? And you can go in whatever order you would like.
I'll kick us off. I think community and collaboration. We are not alone in this work. I work with, coalition partners representing different communities of color, gender justice organizations, working on issues across the spectrum. And so being able to partner together and know that we are not alone is my source of strength right now.
Yeah, I really appreciate that, Amalia. I think what gives me hope is that there is amazing, courageous, impactful work happening all across the country every day, including in my hometown of Philadelphia. And just seeing how people are keeping at this is so inspiring to me, despite how they're trying to, how the administration is trying to use intimidation and the power of the purse to really cut off equity work. And I think it's just a reminder that this work requires a long-term view, along with a sense of urgency. And it's holding those two things, even though they seem like they can be in so much tension sometimes, just holding those two things together. And that there is always backlash when there's progress, and there will be more progress. So that's what really gives me hope.
I have nothing really to add. I would say the same things, just being able to work every day with my colleagues here, and then with the communities who we serve and provide technical assistance to and answer questions from, and just being in partnership with everyone is hopeful, and to say something different. That is a beautiful spring day today, and excited to go outside after this and take a walk.
Thanks, Katie. All right. Well, thank you. I'm going to quickly close us out with a couple of resources, but I just want to really thank all the panelists today. This has been a really insightful conversation, and one that I hope we can continue. This is not the end by any means of this conversation. So just quickly, here's a link to the primer in case you missed it. There is a QR code there. If you please share it, and if you have thoughts and feedback, we would love to hear it. We also have a collection of many other resources on good governance, which you can access here on through this QR code, including phrase and practical resources. And coming up next week or the week after, we also have a training on finding and reading the law. It is getting full, so if you're interested in that, please do sign up soon. I think registration closes on the 14th, which is maybe tomorrow or the next day. I've lost track of dates this week. And with that, that will bring us to a close today. Like I said, if you have additional questions or want to inquire about technical assistance, please do reach out. There's contact information here. A survey is going to pop up when you close out of the webinar, but you will also get it via email with the recording and the slides. It's really helpful for us to understand how this went for you and what questions you still have and what resources are useful. So please, if you have a moment, fill it out. And like I said, stay tuned for more resources on this topic. And just a final hearty thank you to everyone who's joined us in the audience, and also the panelists today. Have a great afternoon.